Are you wondering what type of delivery to have after a C-section? Now, following a cesarean section, you have two modes of delivery. The first is trying for a natural birth, or what we call vaginal birth after cesarean section, VBAC, or going for an elective repeat cesarean section. Now, the choice is yours to make based on your history and based on whatever discussion you have with your doctor. Now, sometimes the choice is fairly straightforward, depending on certain factors. For example, if the reason for your previous cesarean section was something that could repeat itself in this pregnancy, then it's obvious that you need another cesarean section. In addition, if your baby is in an abnormal presentation, such as breech presentation, or in an abnormal lie, like transverse lie, with a previous cesarean section, then it would be advisable for you to go for a cesarean section. Also, if you have abnormal placenta, like placenta previa or placenta accreta, then you should have a cesarean section. Now, if there are no contraindications to trying a vaginal birth, then it means your options are still either to go for a VBAC or an elective repeat cesarean section. Now, both of these methods have their pros and their cons, or their good sides and their bad sides. Now, let's take the vaginal birth after cesarean section. The good thing about VBAC is that every 3 in 4 women who try to have a natural birth after cesarean section will succeed. And if you have a successful VBAC, it actually increases your chances of subsequent successful natural births. And also, you have the advantages of a natural birth, such as faster healing, going home on time, more straightforward recovery, bonding with your baby quickly, and avoiding complications of surgery, including anesthesia. Now, the cons or disadvantages or risk of VBAC is, number one, sometimes it fails. So it means that you could go through natural labor and still end up with a cesarean section, irrespective. But the most feared complication of a VBAC is something called uterine rupture, which simply means the scar on the womb giving way during labor. This is actually an acute emergency and life-threatening, but thankfully only occurs in 1 in 200 women. Now, if we look at the second option of delivery, which is an elective repeat cesarean section, the pros or the advantages of that is that everything is scheduled. So it removes the unpredictability of a vaginal birth. You're given a date, you're given a time, you show up, you have your C-section. However, the drawbacks or the cons of having an elective repeat cesarean section is that it is major surgery, and repeated surgeries means more complications and more prolonged healing usually. So, if you're thinking about what method of birth to go through after a cesarean section, it's very important to make sure you have a birth preparation meeting with your team to discuss all of this more comprehensively so that you can make an informed decision about what method you would like to pursue. If you have questions about this, drop them in the comment section and I'll answer them. Share this video, like, and follow me for more tips.